Doctors are warning about these long-term medications, causing organ damage. Many people do not realize that some medications are designed mainly for short-term use, or they require regular medical monitoring when used for long periods. When certain medicines are taken for years without proper review, they may slowly increase the risk of damage to organs such as the kidneys, liver, heart, brain, bones, or digestive system. This does not mean you should suddenly stop any prescribed medication. In many cases, the benefits are greater than the risks. But it is important to know which medicines deserve a closer look and regular conversations with your doctor. Today, we will talk about several common medications that may cause problems when used long-term, especially when they are taken without regular medical supervision. Let us start with one of the most common groups of medicines in the world. Number 1. Pain relievers and NSAID medications. Millions of people take pain relievers every day for arthritis, back pain, headaches, and other chronic aches. Medicines such as Ibuprofen, Naproxen, and similar anti-inflammatory drugs can be very effective at reducing pain and improving quality of life. Ibuprofen, commonly known by brands like Nurofen or Advil. Naproxen, available under brands like Naprosyn or Aleve. Diclofenac, often found as Voltaren, commonly in gels. Celecoxib, a prescription-only NSAID sold as Celebrex. But long-term use can put significant stress on the kidneys. Research has shown that these medications can reduce blood flow to the kidneys, making it harder for them to filter waste from the body properly. Over time, some people may develop chronic kidney disease, especially older adults, people with diabetes, people with high blood pressure, and those who already have reduced kidney function. These medications can also irritate the lining of the stomach and intestines. Long-term use may increase the risk of stomach ulcers, internal bleeding, and serious digestive complications. Some research has also linked long-term use of certain pain relievers to an increased risk of heart attack and stroke, particularly when high doses are used regularly. Acetaminophen, also known as paracetamol in many countries, is often considered gentler on the stomach. But taking high doses for long periods or exceeding recommended amounts can place stress on the liver. The liver works hard to process medications. When too much acetaminophen builds up, liver cells can become damaged, sometimes severely. Next, let us talk about number 2, heartburn medications. Many people experience acid reflux or heartburn and turn to proton pump inhibitors. Examples include omeprazole, esomeprazole, pantoprazole, and similar medicines. These drugs are extremely effective at reducing stomach acid. They can be life-changing for people with severe reflux disease or stomach ulcers. But stomach acid exists for a reason. It helps absorb important nutrients and helps protect against certain infections. Research has found that long-term use of proton pump inhibitors may be associated with lower levels of magnesium, vitamin B12 deficiency, and reduced calcium absorption. Over many years, this may contribute to bone fractures, especially in older adults. Some research has also linked prolonged use to an increased risk of chronic kidney disease and kidney injury in certain patients. There is also evidence suggesting a higher risk of certain intestinal infections because lower stomach acid may allow more harmful bacteria to survive. This does not mean everyone should stop these medicines. Many people genuinely need them. But long-term use should be reviewed periodically to make sure the lowest effective dose is being used. Now, let us discuss number 3, sedatives and anxiety medications. Drugs known as benzodiazepines include medications such as diazepam, lorazepam, alprazolam, and several others. These medicines can provide fast relief from anxiety, panic attacks, and severe stress. They can also help some people sleep, but they were generally designed for short-term or carefully monitored use. Over time, the brain may become dependent on these medications. This means the same dose may become less effective and larger doses may be needed to achieve the same effect. Long-term use has been associated with memory problems, slower thinking, reduced concentration, and increased risk of falls in older adults. Research suggests that prolonged use may affect brain function, particularly among elderly individuals. Falls caused by dizziness or sedation can result in fractures, hospitalizations, and loss of independence. The risk becomes even greater when these medications are combined with alcohol or certain pain medicines. Number 4. Another group of medications that deserves attention includes common allergy and sleep medicines. Many over-the-counter sleep aids and allergy medications contain older antihistamines such as diphenhydramine. These medicines can make people feel sleepy, which is why they are often used as sleep aids. But long-term use may affect brain function, especially in older adults. Research has linked long-term exposure to strong anticholinergic medications with an increased risk of memory problems and cognitive decline. These medications can also cause dry mouth, constipation, blurred vision, and difficulty urinating. In older adults, these side effects can become much more serious and may significantly affect daily life. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Number 5. Now let us move on to antipsychotic medications. Antipsychotic medicines can be extremely important for people with conditions such as schizophrenia, bipolar disorder, severe depression, and certain behavioral disorders. These medications have helped countless people live more stable and productive lives. But long-term use requires careful monitoring because some antipsychotic medicines may affect multiple organs and body systems. Certain antipsychotics can increase weight gain, blood sugar levels, and cholesterol levels. Over time, these changes may increase the risk of type 2 diabetes, heart disease, and stroke. Some antipsychotic medications may also affect heart rhythm, which is why doctors often monitor patients carefully. There is also the possibility of movement disorders developing after long-term use. These conditions may cause involuntary movements of the face, tongue, or other parts of the body. The risk varies depending on the specific medication and the individual patient. For many people, the benefits of treatment greatly outweigh the risks. But regular medical reviews remain very important. Number 6. Let us now discuss estrogen therapy. Estrogen pills and patches are commonly used for menopause symptoms such as hot flashes, night sweats, and other hormonal changes. For many women, these treatments can dramatically improve quality of life. But long-term use requires an individualized discussion about risks and benefits. Research has shown that some forms of hormone therapy may increase the risk of blood clots, stroke, and certain cardiovascular problems in some women. The level of risk depends on factors such as age, overall health, family history, and whether estrogen is used alone or combined with another hormone. Some forms of estrogen therapy may also influence the risk of certain cancers, depending on the individual situation. This is why doctors usually recommend regular evaluations to determine whether treatment should continue and at what dose. Number 7. Another medication group worth mentioning is corticosteroids. Examples include prednisone and similar medications that are often prescribed for inflammatory conditions. These drugs can be extremely effective and sometimes life-saving. But prolonged use can weaken bones, increase blood sugar levels, raise blood pressure, and suppress the immune system. Research has found that long-term steroid use may contribute to osteoporosis, making fractures more likely. These medications may also affect the eyes, increasing the risk of cataracts and glaucoma. Now here is an important point. The danger is not always the medication itself. Sometimes the real problem is taking a medication for years without regular medical review. A medicine that was appropriate 5 years ago may no longer be necessary today. Your health changes over time. Your kidneys change. Your liver changes. Your heart changes. The medications you take may also interact differently as you age. This is why medication reviews are so important, especially for older adults and people taking multiple prescriptions. Doctors and pharmacists can often identify medicines that may no longer be needed or doses that could be reduced safely. If you are taking any of the medications discussed today, do not panic and do not stop them suddenly. Stopping some medications abruptly can be dangerous and may cause withdrawal symptoms or worsening of the original condition. Instead, schedule a conversation with your healthcare provider and ask whether your current treatment plan is still the best choice for your situation. The goal is not to avoid medications. The goal is to use the right medication at the right dose for the right amount of time. Modern medicines have saved millions of lives and continue to improve health every day. But every medication comes with benefits and risks, and understanding both sides helps you make better decisions about your long-term health. The most important message is simple. Stay informed, ask questions, review your medications regularly, and work closely with your healthcare team to protect your kidneys, liver, heart, brain, and overall health for years to come. Add the sentence at the end. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.